Hello everyone, I am Tabrez, an international medical graduate studying MBBS in Manaparthi Government Medical College near Hyderabad in the Telangana state of India. Also, I am an alumni of USMLE Islamia Central University, New Delhi. Today, we'll talk about USMLE Step-1 exam, its syllabus, subjects, and proper resources required. See, we all want to be successful in our life. We want productive life. And for that, we believe in motivation. Some of us believe in discipline. Many of us believe in intensity, one night study. But most of us believe in consistency. See, the first graph is about motivation. The second graph shows the reliance on motivation and reliance on consistency. The third graph talks about that we can have growth along with discipline and consistency. If we have discipline and consistency, then surely we'll have growth in our life. The fourth graph that shows intensity and consistency. Intensity means we wait for the exam, that if the exam comes closer, nearer, then we'll start preparing, and then we start studying throughout the night. That shows intensity. Okay. And what is consistency? Consistency is making a small efforts daily in a time frame, proper time frame. All these things, motivation, discipline, consistency, and intensity, can give result. But why I have shown these graphs and why these graphs are important to understand? Simple: motivation initiates the journey, discipline sustains daily effort, intensity accelerates critical phases, consistency determines final outcome. So, for the success in USMLE, actually, we need a small discipline action repeated daily, which we say consistency, over months, not for one day, for the time we have fixed to prepare for the USMLE exams and sit in the Step 1 exam. So, the simple truth for the USMLE, after analyzing all these graphs, that we need consistency and discipline more than motivation and intensity. Now, let's talk about USMLE. USMLE is United States Medical Licensing Examination, which is a three-step examination that is required for graduates of medical schools from all over the world to appear for a residency position in the USA, which leads to independent practice anywhere in America. The USMLE Step 1 and Step 2 are required at all US medical schools, and international students or graduates need it only if they want to work in the USA. Understood? Now, see, USMLE is a three-step examination. So, first examination, I should say, step one, that mainly focuses on concepts and mechanisms. Step two, CK means clinical knowledge. It focuses on clinical reasoning. And step three, that mainly focus on real life patient management. So the first step mainly focus on preclinical subject, and step 2 CK that focuses on clinical subject. We'll discuss about it in details. And step 3, that is match residency. So what is the purpose format and length of USMLE Step 1 exam. Now we'll discuss about it. See, Step 1 purpose is to assess the examinee's understanding of ability to apply important concepts of the basic sciences to the practice of medicine with a special emphasis on principles and mechanisms underlying health, first, disease, and modes of therapy. All these three things means a lot. For health, what do we study? For disease, which subject we study? And for modes of therapy, what do we study? See, this purpose tells in itself the syllabus, which we will discuss in detail later. So the format is really important to understand. Approximately 280 MCQs is being asked, which is divided into 760-minute blocks. So actually, it will have 7 blocks. There will be 60 minutes for each block, and total question will be 280 MCQs. Okay, there is no negative marking. And now we'll discuss about length. See, this is 1 day exam, like NEET PG is the 3 hours exam, but it is 1 day exam. Approximately, we need 8 hours a day. Clear? Purpose, format, and length we have discussed. Now we'll discuss about syllabus and subjects for the USMLE Step 1 exams. It is very important to understand. See, the syllabus of USMLE Step 1 is firstly human development, then immune system, blood and lymphoreticular system, behavioral health, nervous system and special senses, skin and subcutaneous tissue, musculoskeletal system, cardiovascular system, respiratory system, gastrointestinal system, renal and urinary system, pregnancy, childbirth and the puerperium, gender, breast and reproductive health, female, male, transgender, non-binary, endocrine system, multisystem processes and disorders, biostatics, along with the epidemiology, population health, and interpretation of the medical literature. And lastly, we need social sciences as well for the communication skills. So this is the syllabus. Now, what could be the weightage of all those systems and topics we discussed right now? See, human development as almost percentage of 1 to 3% means if there is 100 questions, then there is a probability of 1 to 3 questions from human development, and from blood and lymphoreticular or immune systems, they may ask 88 to 13% of the total 280 questions. From behavioral health and nervous system, actually 10 to 14% of 280 questions being asked. From musculoskeletal, skin and subcutaneous tissues, percentage of questions is 7 to 12%. From cardiovascular system, it is 6 to 11%. Respiratory and renal or urinary systems, it is 10 to 15%. Gastrointestinal system, it is 5 to 10%. Reproductive and endocrine systems, 9 to 13%. Multi-system processes and disorders, it is 11 and 16%. Biostatics and epidemiology or population health, 4 to 6% of the total questions. And social sciences, communication and interpersonal skills, questions maybe 6 to 9%. So are you focusing? High yield system is hematology, and nervous system, and musculoskeletal system, cardiovascular system, renal system, reproductive system, and gastrointestinal is also somehow is important. Reproductive and endocrine systems also important. Multi-system processes and disorders 16%. It is very high yield. And biostatics and epidemiology, social sciences, that is low yield topics. Okay, so these are high yield topic. But these two is, we can say, along with the human development, they are low yield topic. Okay, so knowing the weightage, we can start preparing accordingly. Now let us talk about the subjects for the USMLE Step 1. Now we are clear with the purpose, we are clear with the format, we are clear with the topics and systems. So system is very important to understand. Actually, USMLE asks the question system wise mostly. So we have discussed the system, and now I'll discuss about the subjects. See, for the system we'll access the subjects to study. So we have seen all those high yield and low yield topics. Those system or the topics can be studied in pathology, physiology, pharmacology, biochemistry, nutrition, microbiology, immunology, gross anatomy, embryology, histology and cell biology, behavioral sciences, and genetics. Okay, so very important to understand that from pathology, almost 45 to 52 questions are being asked. From physiology, 25 to 35 questions being asked. From pharmacology, 15 to 22 questions being asked. From biochemistry and nutrition, 14 to 24 questions being asked. From microbiology, 10 to 15 questions. Immunology, 6 to 11 question. Gross anatomy and embryology, 11 to 15 questions. Histology and cell biology, 8 to 13 question. Behavioral sciences, 8 to 13 questions. And from genetics, 5 to 9 questions are being asked. Understood? So first subject is pathology, then physiology, then pharmacology, biochemistry, microbiology, immunology, anatomy, histology and cell biology, behavioral sciences, and genetics. So, almost there are 10 subjects to study for step 1. Radhaminda. So, this is a pie chart analysis of subjects for the USMLE step 1. So, you can think green color shows pathology. So, pathology actually includes 25% of the total questions. And then comes anatomy, then comes pharmacology, then comes, you can understand, microbiology, pathophysiology, and etc. These are low yield subjects, but we have to prepare for that as well. Now we have discussed about the syllabus and subjects as well. Now I'll discuss about the resources for the USMLE Step 1. See, I have finalized these resources after endless research. And for you, it's an escape for endless research about resources for the USMLE. So let's look today what resources we should utilize for the USMLE Step 1. See, first aid is the first learning tool. People say it's the Bible of the USMLE. And secondly, UWorld, it's our testing tool. and everything else is support only. So support only resources for the USMLE Step 1 for the lecture purpose, wherein we'll use the method, we'll watch the lecture, we'll annotate the first aid, and then we'll revise daily. So for pathology, we will watch pathoma lecture. For microbiology, we'll watch schematical. For pharmacology, schematical. For physiology, boards and beyond. For anatomy, for both histology and embryology, we will watch boards and beyond. And for biochemistry and genetics, we'll go for the dirty medicines. Okay. So, what could be the message for the resources? That resources don't give scores. Revision and question bank analysis gives the better scores. So basically, our resources should be first aid, and then UWorld, and there's pathoma, sketchy, boards and beyond, dirty medicine that can be used for the lecture purpose only. Okay, so this is the resources we can go for to prepare for the USMLE Step 1. You can pause, you can think about it, you can take a screenshot as you wish. Now, see, we may be in first year, the second year, third year, fourth year, or in internship. So that could be timeline for the USMLE. So if we start from the first year as a medical student, if we are studying in first year, we can start preparing for the USMLE from the first year as well. Okay. So see, if we start preparing from the start of the MBBS, then at the end of the third year, what we can do, we can take step 1 by the end of the third year. Okay, and first half of the internship, we can start CK preparing during final year. We can apply for the clerkship with the step 1 score, and we can also take CK by the end of the first 6 to 7 months of the internship. We can make sure to have strong grasp of final year clinical subjects, and that is more important. During the second half of the internship, we can go for the clerkships, electives, absorbships in America to have clinical exposures in the hospitals of the America. Meanwhile, we can also give occupational English test. It's essential to prepare to go for the match residency, and it depends on the individuals. You know which months should be preferred is after the internship or during the internship. Mostly people go for August. Okay, so we can come back from America, then we can finish rest of the internship and graduate, and we can get CFMG satisfied, and we can plan the step 3 by applications, or at least accordingly. If you have planned August, then then 31st of the December can be can be planned for the step 1. So actually, if you have completed step 1 during at the end of the third year MBBS, and during half of the internship we have completed the step 2, then we can apply for the match residency, and it is the purpose we prepare for the USMLE exam. We have sole purpose, we have only core objective is to practice MBBS in America, medicine in America. See, for the match residency, step 2 score is important, but along with that, research is also important. So, as a medical student, we can do research in ICMR STS, summer research fellowship program. Okay, then also we can ask for the research opportunities during rotations in the USA. Yeah. So volunteering opportunities can be, NGOs, doctors without borders, PSM, rural postings, etc. It is not too much important, but we can consider it as well. Now, what could be the phases of preparations for the USMLE Step 1? Let's talk about it. See, I have analyzed it very carefully and then divided it into 6 phases of preparations for the USMLE Step 1 exam. So, first phase is foundation phase, wherein we build concepts using first aid, boards and beyond, pathoma, and sketchy, sometimes dirty medicine for the biochemistry. Second phase is question bank learning phase, wherein we practice UWorld system wise with deep review, and then comes third phase, which is dedicated phase, wherein we practice 2 to 3 UWorld blocks per day along with NBME and first aid revisions. And fourthly, we come to the assessment phase, wherein we, along with the U World self assessment, we practice NBME Free 120, which helps in our score predictions. Okay, and fifth phase is final revision. If we have last 10 to 14 days, then we will revise first aid and learn from the mistakes. And lastly, we'll go for the exam. So the rule of the phase of preparations for the USMD is that we first build concept, then we practice question, then we revise accordingly, which helps to score more than 230, which is more than enough in step 2 exams to go for the match residency. Okay, so thank you for all the patience you have right now to watch my videos. See, right now I have 14 subscribers, which means a lot, and also 163 views for a single video. It in itself means a lot. Thank you so much for trusting in my video, which I have uploaded 11 days ago. Now, I would request you all to comment about what my next video should be. I'll be waiting for your comment as well. Thank you for watching. Like, share, and subscribe, please.